newtons, and you will disintegrate the implant. Sometimes, not all the time, but sometimes bone is so dense that this also breaks. This also breaks. That happens very often. Don't panic. Usually it breaks right here, right? Then what I want you to do, usually it breaks right here at the tip. Then what I want you to do is take the burr, go deeper.
Drill it
So
out.
you won't be able to drill it out because it's co-welded. It almost becomes like one piece, right? So you're just drilling deeper. Then you use the exactly same fixture removal kit because implant has a shape inside. It may bind here, it may bind here. Correct? I usually like to bind it here. Then it won't break and you are able to engage more than 400 newtons. But sometimes in narrow implants, you may bind here and that's when you break it. So when this breaks, drill it deeper so that you gain another binding at the coronal portion and then you can reverse it.
What are you drilling deeper?
How you drill deeper? With the burr, with the 558.
Are you drilling right in the middle of the removal, or where are you drilling?
You're drilling right at the removal, yes.
You don't know anything?
Yes.
I have before where I did a flower with a broken
Implant number
implant.
9.
Say that again?
I've used this before and I've broken an implant, you know, because it was too narrow. And for
It
each
would if you
thing
did that
approach.
originally.
Yep. I will talk about that when that happens. Next slide.
To remove implant number 9 because of aesthetic reasons. Gummy smile. So we're gonna try to fit in. As you can see, we have a couple different sizes. When I try in the wide one, we didn't get any binding. So we're going to try with the narrower one. We're getting some binding here.
So you have to try different sizes, Amanda.
And
One
we're
that
going to
fits.
use counterclockwise position.
And you want to kind of, when you get binded, you want to go kind of slow.
Binding the implant
Rudy can go.
Okay.
deeper.
You
Okay.
see how I broke?
So what would happen if you shortened that one?
Uh-huh.
If you shorten the one that just broke, if
Yeah.
you shortened that to try to catch it higher up on the,
We have to drill the inside of the implant because the broken part is inside the implant.
but it's at the apex, right? And you want to catch it at the top? So
Yeah.
if you shorten the break,
Uh-huh.
wouldn't the wider part then catch the top of the implant?
Dr. Bird, you're exactly right. We want to catch the top, but it won't stay.
It won't.
Yeah, you won't stay. So the newer version, this is the older version. The new version, we made it actually shorter. That way, because the pointy area is too narrow and it tends to fracture like this, right? So we already modified, right, the new set. So I drilled it and I tried one more time with the exactly same broken one. You could see the powder because I already drilled the inside.
Sometimes it breaks and we just gotta grind deeper.
So it's engaging the implant. It's making its own thread. And I want to catch the top portion. Right now the implant,
Are you threading inside the implant fixture removal right now? Is that what you're doing?
yeah, I'm making a thread inside of an implant, yes.
So if there was a tooth number 9 there, it doesn't look like that wrench would fit in there. Is there an extension for that as well?
Yeah. You thought of everything. Yes, we have an extension. Now,
While we broke it, we kept on going on.
now notice that the angulation is off. So we actually, when I made the holes, I made the hole off angle. You know, because I'm human, right? But still it worked. Because he engaged portion. So this is the Fixture Remover Kit. It does come with the extension because sometimes we need to use the extension, and it comes with a different size. Unfortunately, when you take it off, it's one time because it co-welds and it's impossible to take them apart. So this is another case.
Fixture Remover Kit.
On the mandibular, now this one is a very difficult case because it's a mandibular and she is brachyfacial, she grinds her teeth, she broke the implant. So in this type of cases, density of the bone is like 400 newtons to remove the implant. Also, our patient will be very difficult as well because you look at his jaw, right? So unfortunately, implant broke. Extension.
True. Yeah, it's really good implant, huh?
Counterclockwise, right? And I'm putting a lot of force. This is mandibular bone. This is that. Today will be not easy also.
This is a lot of force.
Mandibular 10 times more difficult than maxilla. Maxilla is easy.
Oh, I got it.
You see the ratchet is much longer.
Wow.
Something moving.
So we're putting apical pressure at the same time.
Wow.
Because the implant broke, we don't have nothing to do.
This, by far, was the most difficult. Can you go get me one more? One more. This torque wrench broke. Yeah.
The torque wrench broke.
We disintegrated.
I need a new torque wrench.
But this,
The torque wrench actually broke
mechanic
at the neck. Oh, you got loose. You did break.
It's okay. It's okay. Look at that. Oh my lord. Video. Oh my lord.
Yeah, what happened was it was so much torque.
Most difficult case
You got
I've
loose,
done in my career. Okay, zoom out. Sergio, zoom in. Stay here. Stay here. Implant's coming out.
Baby, it's coming out.
I believe. Brachyfacial patient requires more than 1,000 newtons per centimeter. Zoom out.